In the beginning, medicine and especially emergency medicine can be daunting. I mean, it's the wild, wild west in the emergency room. So you have all of the normal medical things, and then every day you're going to come across social things and drug stuff and all sorts of things that you never once learned about at all. But you have to know how to solve the problem. It's kind of cool, but it's also a little overwhelming. So keep an open mind, take pause and relax, ask a lot of questions, lots and lots and lots of questions. Work on growing your confidence gradually and reasonably, but always have that as a goal of just continually being more confident in what you do and how you do it.
Yeah. I'd agree with that. So like with new grads coming in, it's definitely, we always try to tell them like it takes a good 6 months when you first start to finally feel like I can go in one room by myself and come out and feel like I did everything I was supposed to do. And then a year before you feel like you're knowing, like you know what you should do. And then by 2 years that you're efficient at what you're doing. And so we always just really try to at least I recommend to people, like, try to stay on that path. Like, yeah, some people may reach it sooner, some may take a little longer. But I've noticed with emergency medicine, a lot of the people who come in for nursing wise are like kind of almost that adrenaline junkie. And they're like, oh my God, I want to do this and I want to do that. And it's like, well, yeah, it's great to learn all the big stuff too. But I'm like, but this is our basic stuff. This is our bread and butter. You need to know how to do this efficiently before you can kind of, move over to something that's bigger or different or more exciting, as what they would call it. So that way you can be a well-rounded nurse and not just always looking for the big scary things that everybody's coming in for. Like, I want to be in the trauma bay or whatever. So those are one things we always try to tell everybody. It's just, just take it one day at a time. Like when I came down from med surge, I was shocked by the emergency department. I was like, oh, I probably should have did a shadow day. I had no idea what I was walking into. I was like, this is crazy. So also having that understanding of what it is that you're going into. Like, there's so many people who fantasize about it. They don't take the time to actually investigate the career path they want to go into, at least for nursing. Like, everybody gets that clinical experience where you work med surg, you work onc, or blah, blah. It's like, take the time before you're hired to shadow. Like, a lot of places let you shadow so you can actually see what it is that you're really getting into. Because then they'll have people who walk in and are like, this is not what I thought, this is not for me, but they could have been a fantastic nurse there, but they didn't get the opportunity to kind of walk in prepared.